My name's Amalia and I'm at Birtleview and Kirkholt Medical Practice. It's been really good. I was a bit nervous initially going into, I didn't really know what to expect because all my placements have been in hospital. So it was a bit of a different setting, so I wasn't sure, but it's actually turned out really good. I've gone from, when they ask, I normally say a cheap doctor, or I try to say I'm the one in the middle of the nurse and the doctor, just because they keep, a few people have sort of said, oh, so you're in your fifth year of medical school, or how far are you in your training type thing. So I have to sort of explain to them that I'm doing a master's, but I normally just start off with a cheap doctor so that they sort of have an idea of what I can do, and what I'm doing with them. I kind of know what I'm doing in that sense, yeah. I didn't really, like I said, I didn't really know what to expect. I thought I'd probably do a lot more shadowing. I'm quite relieved that I am running my own clinics at the moment, because I thought that I was just going to shadow a lot of people. I just thought 8 weeks of shadowing people was going to be a bit not as fun as it's actually turned out to be. The highlights have been that I've been able to shadow not just a GP, but I've got other health professionals that I'm with, some diabetes nurses, practice nurses, even HCAs, because then that helps me to develop my blood taking skills, injection skills, that sort of thing. So I'm really pleased that I'm not just in the GP, I'm getting like a whole approach to my skills and my learning as well. I can't think of anything in particular, no. So when I introduced myself, I sort of said like I'm a physician associate trainee, and I thought by me saying trainee that it might put people off in the sense that you're not like a real professional in that sense. But it's actually been the opposite. I find like even when patients come in and they're openly telling me like the problems or whatever's going on, and I thought there might have been a barrier with me saying trainee, and there isn't any barrier, which has actually been that's been interesting to see that me saying training has not actually produced a barrier between me and the patient. So that's been good. I wouldn't right after my graduation, and it's got to do with my competencies. So the fact that I can't prescribe now makes me feel like I'd be better suited in acute care than in the GP surgery, just because having seen the patients and then going and getting it signed off, I feel like I'm doing double the work or making more work for another person. And I've had it also described to me by another GP saying that I've not, like, the GP's not seen the patient, I've seen the patient, and I'm going to the GP saying I need this prescription. I'm sort of he's putting himself at risk by signing that prescription, and GP sort of explained that to me. I can sort of see where they're coming from, and I can't imagine that he'd be the only one with that sort of opinion. So I think in a couple of years time, when they've sorted everything out and we got prescribing rights and I can prescribe, I would love to be in primary care, but as of now I see myself more suited in an acute hospital setting. Yes, I would. Primarily because I feel like, especially because I'm at the end of my 2 years and I've sort of had most of the teaching that I'm going to have, it's a great way to sort of put everything that you've learned into practice, to hone on the skills, the ones that you know, to perfect them, the ones that you're not so great at, to recognize and practice them. The things that you know well, you realize that you know well. The things that you don't know so well, you know that you need to go and review them. So it's a really good opportunity, especially for learning.